Did you know that the shape of your gallbladder can vary? One interesting variation is an incomplete S-shaped contour caused by an incomplete fold within the gallbladder. This fold doesn't span the entire lumen, resulting in a distinctive shape. When looking at ultrasound images, you may notice a prominent fold within the gallbladder. However, unlike a complete fold, that fully separates the gallbladder into distinct compartments. This partial fold only partially separates the gallbladder lumen. Despite this, the lumen remains continuous, allowing bile to flow through the entire gallbladder. It's important to note that the wall of the gallbladder should appear normal, without significant thickening, assuming there are no underlying inflammation or other issues. Additionally, bile within the gallbladder typically appears as a dark anechoic, echo-free substance. However, sludge or small stones might be present and should be assessed. Now let's discuss the significance and prognosis of this condition. An incomplete S-shaped gallbladder, due to an incomplete fold, is not a pathological condition, but rather a congenital anatomical variation. It occurs as a result of the developmental process of the gallbladder. Fortunately, this variation typically doesn't affect the overall function of the gallbladder. Bile storage and release during digestion remain intact, and most individuals with this variation don't experience any symptoms. However, it's essential to be aware that occasionally small stones or sludge can get trapped within the fold, potentially leading to complications like cholecystitis or other biliary symptoms if obstruction occurs. The prognosis for this condition is generally excellent. It is considered a benign anatomical variant, and regular monitoring usually isn't necessary unless symptoms develop. Although rare, complications such as gallstone formation or sludge accumulation can occur due to stasis within the folded area. In these cases, medical or surgical intervention may be required to treat cholecystitis. For symptomatic patients or those with complications, periodic ultrasound evaluations may be necessary to monitor changes in gallbladder morphology, stone formation, or signs of cholecystitis. In conclusion, an incomplete S-shaped gallbladder caused by an incomplete fold is a benign anatomical variant with a positive prognosis. It's crucial to be aware of this condition to differentiate it from pathological findings. On imaging studies, your healthcare provider can provide further guidance and monitoring if needed.